In this video we're going to have a look at trigger points. So there's not lots of videos on this because it's a very simple technique. So we do a press test first of all to decide if we're going to do a trigger point, and if we are, we then need to do the trigger point. So in the theory notes I mentioned that trigger points are usually found in, or always found in, taut bands. So if you find a taut band in someone and they've complained of radiating pain, you've generally got a trigger point. So you'd find that taut band and you'd feel along the length of it, and you're looking for some small area that's particularly sensitive. So we would say here maybe, for example, and we do our press test on it, and then we would look to treat it. So get your client to breathe in and breathe out, and as they breathe out you're going to press in. So tell me when that gets to a pain point of 7. Okay, so we've got the pain point of 7. And we just hold it here till it decreases to as low as possible, or a 0. Once we get to that low number, we will then go deeper. So breathe in for me and breathe out for me. And again you press in and you get to that pain point of 7. And you hold it there. So to find out obviously if it's decreasing, you need to be talking to your client and getting feedback from them, and they will then tell you if as and when the pain decreases. So this is a static way of doing it, and a trigger point takes as long as a trigger point does. It could be 4 minutes that you're stood here going through this process, but you keep going until you get you can't get it any lower from going deeper. So once you've done that, you then need to stretch the area, and you can use an easy manual stretch. You'd come back out of your trigger point, and for say an area like this, I'd put one hand there and one hand there, and I'm stretching that specific area of tissue. But if it's in an arm or something, you can use the stretch that works with that. The other method of doing it is pulsing your trigger point. So you have to stay on the same point, but what you do is you go in, find your point of 7, hold for 5 seconds and come back out again. So the benefit of this is maybe if somebody's particularly sensitive, or you've got a particularly difficult trigger point that's not releasing, it's a way of agitating it slightly differently. The only problem with this is you've got to get in quite quickly to your pain point of 7, and then obviously back out and in. And make sure you don't move your hands, so don't come completely off. Make sure you stay on that point. Sometimes I will mix it if I'm struggling with trigger point. I will continue to pulse for a while, and then if that fails I will then go into a solid trigger point, and if that fails I can go back to pulsing again. So I've got that option to do the both. Again, always stretch afterwards to make sure that you help to release the fibres around the area. The other thing that's really important when you do trigger points is to watch what's going on around the area. You may see fluttering, you may see red flushes come up, and these might be satellite trigger points that you need to treat. The other thing while you're treating your main trigger point is that you will feel all sorts of weird and wonderful things going on underneath. So you might get something like a heartbeat feeling, and as long as you haven't gone in with a heartbeat feeling, that's fine. But you may find it develops underneath your fingers and then goes. It may flutter, it may flush, or it may try and push you out. If it does that, try and ease up just a little bit, and that should allow you to continue treating it. So normally I'd use thumbs because trigger points are quite small and I can feel the most with my thumbs. You could use a reinforced knuckle or reinforced fingers. You can use elbows, but the sensitivity isn't there. And there is pictures in your manual of using tools. Please don't use tools. You don't have any sensitivity, and I don't think you can really treat an area well with those. So that's your trigger points.